There you go. All
Of
right.
course I did.
All right. Thank you for that introduction. Thank you, everyone, for joining today. Let's go ahead and get started. We are going to discuss program expenses, um, and we're going to do it in the next 30 minutes. So here's a question for you. Have you ever looked at your bank account and you wondered why your balance is low? And then as you're looking through all of your details and your statements, you find the gym memberships, you find the Hulu subscriptions and Netflix subscriptions, you find a lot of eating out and a lot of other Amazon purchases and things like that. Now you may be wondering, what does our personal spending habits have to do with the 340B program? And the answer is a lot. There's a lot that you can learn from both. Given that the 340B program is a program that operates in a nonprofit world, I think it's a good idea to be good stewards of the program and to not only look at the savings and look at how much income the program is bringing in from contract pharmacy and other savings areas, but to also take into account how much you and your covered entity is spending running the program, in operating the program in terms of staff and TPA fees and contract pharmacy fees, etc. My name is Anthony Velasquez, and I've been in the 340B space for about a decade, working primarily on the covered entity side. And in the last few years, I have come over to the third-party administration side, where I am blessed to work with many covered entities and help them manage their program, increase their program savings and compliance by utilizing 340B third-party administrator technology. At the end of this presentation, what I hope is that you all can take some of these things that I'm going to share and hopefully go back to your program and save thousands or even hundreds of thousands of dollars. So here we go. The agenda for today we are going to discuss is number one, your pharmacy network. Are you optimizing your pharmacy network, and are you looking at the right things to ensure that the pharmacies that you're contracted with should remain as part of your network? Your third-party administrator fees and your contracts, those are very important and probably one of the key expenses, or one of the most expensive line items that you could have on your expense sheet for your 340B program. We're going to talk about the pharmacy agreements themselves as well, the Apexis PVP program, and ways that you can find drug savings there, and talk about wholesaler invoices. So starting with your contract pharmacy network. Now, if you're on this call and you manage a 340B program, you might have a network of 10, 20, 50, 100, 200 contract pharmacies. And as you grow and that number is larger, they become very difficult to manage, and you need a lot of resources to manage them, not only from a compliance perspective to make sure that all the prescriptions audited there are eligible for 340B, but also from a financial perspective to make sure that each of those pharmacies are enhancing or providing benefit to your 340B program. I remember a time that I worked as a 340B manager for a covered entity. And at the time, the covered entity had 35 contract pharmacies. All of them were bringing in some sort of 340B revenue in terms of eligible captured prescriptions. However, when you look deeper into the numbers and you take into account dispensing fees, admin fees, wholesaler spend, and other items, whether it's true ups, if that's a process that you utilize with your TPA today, and things like that, I quickly discovered that about 50% of the pharmacies were not truly profitable, and were adding a compliance risk to the covered entity that did not have the reward to go with it. So this is something that you can very easily do, and I encourage every covered entity that is listening to this presentation to find what your true net profit is. That's not just looking at your amount collected by the insurance and the patient copayment minus the dispensing fees, but really look at the whole thing holistically. Look at your admin fees. What are you paying your TPA to manage that? Look at, to see if you have a percentage-based contract or a minimum fee contract. All of those things you want to take into account to ensure that you truly understand whether your pharmacy is really profitable. One idea that you can also implement that I've done in the past and have seen other entities do is to set a minimum threshold. As you're building out a pharmacy network, you want to discuss with your committee, and those of you that were on our presentation last time, I talked about implementing a 340B committee. You want to discuss with your committee what is the threshold of savings or revenue opportunity that a pharmacy should provide to our covered entity, or considering benefit to your program, whether you have a cash card program or that pharmacy is benefiting cash card patients, that you're comfortable with. In my example, when I worked on the covered entity side, it was $2,500. The individual contract pharmacy had to project a net savings, a true net profit of $2,500 or over in order to be considered a good partnership for the covered entity that I was working at. So again, I want to reiterate that the risk versus reward is very important. You want to make sure that you are contracting and working with pharmacies that are providing true benefit, and not just adding pharmacies to your contract pharmacy network just to have a big number of pharmacies, because that can expose you to different compliance risks, that can add additional work that is unnecessary and not bringing value to your program. All right, and then number two, and this is one that I am very passionate about because I live this every day now that I'm on the 340B TPA side and get to see a lot of the contracts. The third-party administrators fees, I will say from my experience, it's probably more than 50% of the time when we are speaking to customers and they have no idea what they're paying their current TPA. There are so many fees in some of the TPA agreements and some of the TPA arrangements that it is truly difficult to keep up with. The contracts, if you've seen one contract, you've seen one contract. They vary immensely in terms of what that TPA may be charging you for managing your 340B program. And beware of the hidden fees. Beware of the hidden fees. I highly encourage a working session where you figure out what your true fees are for your 340B program, whether that is fees that you're paying your TPA for processing your e-prescription file. We've heard some TPAs charging you just for processing a file that should be part of your normal program process. Fees that you're paying to your TPA for reprocessing, for using their referral capture tool. We've heard of TPAs charging a really high percentage-based fee just for utilizing the tool. Fees that you may be paying for specialty prescription versus regular retail prescriptions, minimum thresholds, implementation fees. I mean, you really want to lay out and try to figure out what fees your program, you're paying your TPA to manage your program. And beware of the contract terms. We're seeing situations where some TPAs are sending covered entities contract terms that completely remove any ability to get out of the contract, and you're locked in for 3 years, auto renew 3 or 5 years. We've had entities who want to terminate a bad contract and they're not able to unless they pay a big fee. So there's a lot of that going on that I don't think enough attention is paid to, and highly encourage covered entities to make sure that you not only understand your contract fees, but understand your terms. What is your ability to get out of the contract? When does it auto renew? Make sure that you set yourself a reminder that if you would like to auto renew that contract, there's no action, but if you would like to explore different TPA options, that you're able to jump in and say, wait a minute, we don't want this to auto renew at this time. Another thing that we see a lot with TPA, especially when a covered entity is shopping around or comparing TPAs, is you're not comparing apples to apples. The way that that administrative fees are charged vary by every single TPA. Every TPA almost charges something different. Some are very complex, some are very simple. Some charge you for claims that are not truly eligible. Some charge you just for claims that are eligible. So it's all over the board. So I highly encourage you not only just to know your fees, know your contract terms, but when you're negotiating or shopping around or doing an RFP, just make sure that you have that conversation in detail about the fees and understanding every single fee that may be included in your contract. In some cases, this is a large piece of your program expenses. You know, a TPA contract could be a multi-million-dollar contract, depending on the size of your covered entity. You know, you could easily have a contract if you're a large dish, for example, that is $1 million, $2 million, $3 million a year. So you want to make sure that you understand, you know, how that contract is being executed and how you're going to be charged going forward. And most importantly, you want to make sure that you're getting the right value from your TPA, right? Since this is your partner that is helping you manage this very complex program that is changing all the time, where you are dealing with data and interfaces and switch data and wholesaler interfaces, you want to make sure that you're getting real value and that the TPA is making your life better and easier and not adding more work and more manual labor than is necessary. All right, going to the next one. So your contra pharmacy agreements. This is a big one. This is a big one because the contra pharmacy agreements are, again, one of those things where they're all over the place. There is no set standards for what a fair dispensing fee is. So I have seen contracts with flat fees, percentage fees, flat plus percentage cap at certain amount, a percentage-based fee per drug type or disease state. So they are all over the place and are just as complicated as the third-party administrator contracts are. So from a dispensing fee perspective, what is fair? That depends. That depends on the market. That depends on the pharmacy. That depends on the type of drugs. There's a lot of different factors that play a role in that. How do you know? I would say ask for help. We have our pharmacy network director at PharmaForce, for example, that is a true industry expert and works with the covered entities, with the pharmacies to make sure that there is a fair agreement between both parties. And we think that that's the right thing to do, right? There is benefit for every party involved, from the covered entity to the pharmacy to the patient. And we think that that should be done in a fair way. And we help to achieve a good relationship, right? You don't want there to be a sour relationship between your pharmacy and your covered entity because of unfair dispensing fees. So we really try to help our covered entities have or negotiate fair dispensing fees, and you should too. Whoever your TPA is, ask for help. I'm sure that there is an expert on the TPA side that can help you as you're growing your 340B program or looking at new opportunities. There are industry averages. There are numbers that most independents are charging, for example, that we're seeing, and that can be helpful in the negotiation. But again, every contract I think is different, depending on the level of engagement that exists between the covered entity and the pharmacy. Additionally, you want to make sure that you understand the analysis of opportunity.
Okay, so tell me, what do we need to do before tomorrow? So do we do this and OPay stuff?
Yes.
Okay.
That's what I'm going to do tomorrow.
Okay, so OPay
But we
stuff.
gotta get this executed. They've got to sign it. I'm gonna.
Okay.
Do you want to do it on the laptop?
Hey, Dan.
Do you want to do it?
I'm trying to
sign
find who was talking and trying to unmute them.
Well, I don't mind signing right now. I don't mind doing it.
All right.
Although you probably want to just take
Empty
this stuff.
those.
Whoever's talking, if you could stop talking. There you go.
Remember, do they require an e-signature?
Anthony, best to just keep talking. You maybe
Okay.
could talk over him.
All right, cool.
I'm trying to unmute him.
All right, so next, in another area that most entities, I'm not sure that most entities know about the Apex's Prime Vendor Program, but it is a voluntary program, very, very easy to sign up for, that
I don't like these
your
screens.
covered entity can sign up
You really
for
see
and
the
be
mouth.
on every,
There.
have on every contract.
There.
Access,
Okay, thanks, Karen. I'll be there.
there you go.
Sorry.
Sorry about that, everyone. Where you can access sub-ceiling 340B prices. So there are the Prime Vendor Program contracts where not only do you, not only will you be able to access, the normal sub-ceiling 340B, the ceiling price of 340B ceiling price, but some of the Apex's Prime Vendor contracts have prices that are even lower than the ceiling price. There is also sub-ceiling WAC pricing. Again, this is something that a lot of entities don't know about and don't take advantage of. It is completely free, voluntary, and can help you reduce your expenses in terms of your purchases of brand drugs, generics, specialty. You can purchase vaccines through these contracts. You can lower your cost on your supplies because they also have special arrangements for supplies like gloves and bottles and empty vials and things like that you can negotiate and you'd be able to get a lesser price on these. And additionally, there's access to a web portal where you can look at 340B prices and different resources. So this is an area where you can reduce your drug spend a little bit. I'm going to announce a part 2 of this. We're going to get more granular into things you can do in your program to reduce your expenses from a true purchasing perspective. But I think this is an easy way, an easy step that you can take to reduce your purchasing expenses on some of your items, some of your supplies, some of your vaccines, and take advantage of this completely free program that you can sign up for. You have to make sure once you sign up for the program through Apex's that those contracts are loaded on every single 340B account that you have. So it's not just signing up, but confirming that those contracts are loaded on your accounts. All right, now jumping into wholesaler invoices. There is a lot to be said about wholesaler in general and wholesaler invoices. But I want to focus on one aspect of that. Again, there's a ton that we can go into. I remember being in managing a 340B program where WAC pricing was loaded on the 340B contract. And things like that, which I'm sure some of you that have worked in 340B for any amount of time can probably say, yep, I've had that happen to me, where the wrong pricing was loaded on my catalog. And that is real, and that does happen, and that can lead to hundreds of thousands of dollars of purchasing inappropriately more expensive than you were entitled to. So that does happen, and I think this is an area that it would behoove covered entities to look into closely, to monitor in some way, especially when you're opening new accounts, to make sure that you're at least going in there and taking a look at the 340B pricing loaded on that account and how that compares to 340B pricing loaded in other accounts. I think that is a wise check to make, at least initially. But here's one thing that I don't think is looked in enough, and I think that can really help covered entities reduce program expenses. There are times where wholesalers are overcharging and CEs are overpaying, and it could be due just to an error on your invoice or your catalog. So I think it will be important to put this as part of your process to perhaps pick a sample of invoices that you're paying and confirm that the amount that you were charged on that invoice really does correlate with the 340B pricing and the pricing loaded on your contract. This is something that, it's one of those things where most covered entities, and I can say, again, I have worked in at least three different covered entities where, for the most part, these invoices are paid by the accounting department. Sometimes they're paid by the department head, but for the most part they're paid by accounting, and they're not even looked at, right? There's just a number that you get at the end of the month, and you add it into your spreadsheet that shows we have $50,000 in revenue from this pharmacy, minus $10,000 in dispensing fees, minus $20,000 in drug costs, right? And that's as far as that goes. But I have heard some very big numbers in terms of covered entities and colleagues in the industry that have been able to implement a process where they're reviewing their invoices every month before they're paid, reviewing their invoices and making sure that they are paying or being charged the amount that they truly should have been charged for those drugs that were purchased. So I think that it would be a good thing to have that process in place, to look at your invoices, make sure that you are paying the amount that is on your catalog, or that is part of your contract, and that amount correlates to your catalog pricing. There are some instances of shipping minimum fees. So we've heard from some of our covered entities that if the order amount is below a certain number, that the wholesaler is charging an additional shipping fee. So you want to look into that. If you have a pharmacy that doesn't have a lot of volume and it's part of your contract pharmacy network, you might have some opportunities there where maybe you configured a threshold of ordering amount with your TPA, or maybe you find out that pharmacy is not truly worth the amount of savings that is bringing in, and perhaps should not be part of your program. But you want to look into that, and you always want to monitor your catalog pricing, especially with, and I've, you can go on our website and download a webinar series that I did on the manufacturer block situation, but especially with the amount of manufacturer blocks that covered entities are dealing with, catalog pricing is, ensuring that is accurate it's probably more important than ever, because there is a lot of changes. There are retail pricing being added to 340B catalogs and 340B contracts that the covered entity has no idea is there. If those blocks or ordering thresholds and blocks are not in place, you could be paying retail pricing or even close to WAC pricing for things that should be at 340B. So again, wholesaler invoice, I could probably do an entire webinar session on just wholesalers in general and contract pricing and all of those things and how to structure those accounts. But I think this is one area that is completely overlooked, and I hope that this was valuable in establishing a workflow, or giving the idea of establishing a workflow where we can look into whether you're being charged the correct pricing. With that being said, I want to announce that on Thursday, August the 25th at 11:30 a.m., we are going to have our next webinar where we are going to do a part 2 and look at different program expenses areas, getting more into, in part 2, we're going to get more into how to manage WAC spending, WAC expenditure, how to structure your 340B program in the way that you reduce or even eliminate WAC spending altogether in certain areas of your program. So that will be part 2. You will see that reminder or email come out from us in order to register for that. And we look forward to having you there. And again, thank you so much, Dan. I'm going to hand it over to you to MC the Q&A, and I'll take a look at a couple of the Q&A ones in here.
Yeah, so thanks everybody. So at this part, Anthony and I will stay on for as long as needed. Sometimes there aren't many questions. Today, I could already see there are a lot of questions. And sometimes we spend an extra hour just answering your questions. As we just saw earlier, there's just too many people now joining this to unmute everybody. Someone could end up talking. So if you do want to, Anthony's going to read the questions and he's going to answer them now. If you do want to have a discussion, no problem. We actually prefer the discussion. Just please click the raise hand button and then we'll unmute you and you can be part of the discussion. So with that said, I'm going to stop the recording so no one has to be worried about recording, and we'll move into the Q&A session.